Hi, I'm Sue Pavitt. I'm a professor in translation and applied health research at the School of Dentistry at the University of Leeds. Oral health disease is a disease of social inequality. So we find it most in areas of social deprivation, and we needed to think of new ways to be able to reach them. Teenagers in particular don't like to be told what to do. So it's no point us going out and saying, brush your teeth, do this and do that. They don't like being told what to do. So we wanted to find a new creative way of reaching them so they could make a difference and it be something that they enjoyed watching as well. So the Cohesion Pilot is about trying to do theatre to portray information about oral health prevention so that we can reach the communities that most would benefit from it. We brought together Theatre of Debate, our own School of Performing and Cultural Industries, and students and staff from the dental school, along with patient public involvement advisors, all together to try and work about how we could work together to try and tackle this straight on. We started the work with bringing Theatre of Debate into Leeds and working very much as an artist in residence along with Judith Johnson, one of the playwrights. They came, they met the dental students, they wanted to hear about what problems were prevalent in dentistry, and the School of Performing and Cultural Industries brought their students along who were going to be the actors for the play. It was a fantastic knowledge exchange. We brought in patients who had conditions with oral health so that they could actually bring that lived experience of having these conditions, and the actors and the scientists could interact and find a way in which to impart some good stories that would be the basis of the Don't Smile play. So Don't Smile was really much a creation of bringing together that cross-working across the arts and the scientists, really to capacity build, that they would think about, artists thinking about doing science dissemination and scientists thinking about how they can get their messages across as well. It's not just about publishing in a highbrow paper. We have to make a difference. We have to get to the people that we need to brush their teeth and look after their oral health. So we went out to schools in the region. Batley Girls' School, worked with David Cooper and his staff, and also the girls at Batley Girls' School, where we've got some real ambassador champions now working with us. And they told us about how they would want to be involved in developing the play, but also about what we could do to create a good debate at their school when the play was produced. And this was really invaluable information and meant that we were engaging with the communities that we wanted to actually reach and get our message across to. We also worked with Jane Gert and her school, and Bernard Woolard of Our Lady of Lourdes School as well, to really get an in-depth understanding of what would be needed to take this project out as an effective play and disseminate our research. Now, Judith Johnson was a fantastic playwright. For somebody to come up with a love theme, with a love story with a dental theme, I think has got to be creative in its own right, really. And that's exactly what she did. She worked very closely with the actors and the students of dentistry, heard the stories, heard what the young people had to say were problems that they were experiencing, and was able to embrace this into a first draft of a script, and then come back for further information from the students, both from the arts in terms of how you might deliver it, but also for the dental students checking in for its accuracy. It's a great capacity building project. Our own dental students can use this project to enhance their own careers and their CVs, and so can the students from the performing arts. A great experience for them to work with professional actors, directors, and understand how a performance is created right from the beginning to the delivery and outreach to the schools. A further unexpected outcome from the Don't Smile project was the enthusiasm at the school, Batley Girls' School, for the pupils and the staff to further want to engage with us. And we've now started another project called Raised in Yorkshire, which is about research in schools exploring dentistry and oral health. And they're going to be doing participatory research where they lead the research. We're giving them some questionnaires and some ideas, and very much they're making it their own. They're going to be doing oral health surveys of the staff and the pupils at the school. So we start to have a longitudinal study going on, capturing the health of the dentition in the school over a number of years. And we're really excited about this. Nothing like this has really happened in a school of deprivation where we see high numbers of dental caries and tooth decay. And so it'd be a great opportunity for us to capture some information that's going to be really meaningful. The pupils are going to be taking photographs of how the students brush their teeth. They're going to be exploring what toothpaste and toothbrushes they use at home. They're going to be using the dental health survey and comparing their results in the school to national survey. And this is going to be really pioneering work, and it's also enabled us to put in an NIHR application called Bright with the University of Sheffield and Dundee, led by Nicola Innes and Zoe Marshman, where we're going to be using the ambassador style of getting the pupils at the school to capture dental information. So lots of really good research coming out now that we had never anticipated was going to be the case. We carried out an extensive evaluation of the play. So this took several forms. At the end of the play there was a debate where we had within the play buried some oral health messages. So we'd worked with the dental students about dental trauma and how people really don't know what to do when they knock out their tooth. So we put this into the play and gave them some clear instructions what they should do. 100% of the adolescents who watched the play all reported that they knew successfully what to do at the end of the play in terms of if a tooth was knocked out. So that's a great start from the beginning. Then we went on and actually asked them a series of questions about what they liked about the play and how they rated the performance. 95.5% of them said that they wanted to have more plays coming to their school on oral health, and I think that's a massive success rate. The fact that they don't normally get exposure to plays meant that it made it quite an exciting thing to come and watch, and that they felt they were being treated. So not only had we achieved our goal of reaching these audiences, but they wanted more, and I don't think you could really ask for anything better than that. So we're really pleased with the outputs.